Stand by, Leon, in 5, 4, 3, 2, and 1.
Hey everybody, welcome to Mission Fitness. Today we are talking about mental health and mental health crisis with a very special guest who has joined us before, and we are very glad to have him back. This is the professor and chair of the Department of Psychiatry and Behavioral Sciences and the director for the Division of Forensic Neuropsychiatry at Tulane University School of Medicine, our friend Dr. John W. Thompson, Jr., MD. Thank you so much for joining us again.
Thank you, Leon.
How are you doing today? Good. So today we are talking about mental health crisis. And we think of, when we hear mental health crisis, we hear of it on the national level. There's a national mental health crisis, or on a state level or a local level. But it boils down to an individual level, where an individual suffers a mental health crisis. What is a mental health crisis?
Well, Leon, typically people don't seek care of a psychiatrist or a mental health professional when they're having minor symptoms, minor depressive symptoms, or they're sad because something didn't go well in their day. Typically, it has to rise to a level where it's impairing their ability to function, or their family members are recognizing that it's impairing their ability to function. So when we talk about crises, it doesn't mean that necessarily every person that seeks care has to be in the most severe of crises, but it's risen to a level where they've decided, this is something I need to do something about, whether they're having depressive symptoms or they're having anxiety, like we talked about before, where the anxiety is affecting their ability to work or affecting their ability to function on the job, or maybe their family members are saying, I can really tell that you're anxious and you're just not happy on a day-to-day basis. We really need to get some help for you.
And are these based on when someone gets to that level where they may need help, or they're getting to the point where they need help? Is it based on circumstances or genetics, or a combination of the two?
Yeah, it's almost always a combination. So we try and think of people as being, you can be vulnerable, genetically vulnerable. Let's say if I have a history in my family of bipolar disorder, I might be genetically vulnerable to that condition. That doesn't necessarily mean that you're going to get the condition. In some conditions like Huntington's disease or other diseases, they're super genetic, where you pretty much know that a certain member in the family will actually get the disease. But in psychiatric disorders, we have a genetic vulnerability, but then there's almost always some kind of a crisis that's occurred or a stressor that's occurred that raises the level or raises the valence on what's going on. And the combination of the two things usually ends up with someone either presenting to their family doctor, their nurse practitioner, or their psychiatrist for a need for treatment, and to help them get through.
And as you and I had talked about a little bit earlier before we came on, was that the treatment is more focused on not what has happened in the past, but moving forward and how to take care of it, right?
Yeah, part of the difficulty I think that folks get into in the middle of some kind of mental health crisis is how did this happen? How did I cause it to happen? What did I do wrong? What did someone else do wrong to put me in this position? Really, those things are not very helpful for us when we're evaluating patients and taking care of them. It's really, what are the symptoms that you're presenting with? Are you having difficulty sleeping? Are you having, difficulty at work with performing your job and doing the functions that you normally do? And then what kind of options do we have for treatment? So it's a very simple diagnosis, and we call it DXRX. You make the diagnosis and then you prescribe the kind of treatment that the person needs, and you don't worry too much about where it all came from. If they're presenting with symptoms and they need help, we want to find ways to help them.
And how do you recognize the signs? If you're living with someone that you think maybe, what is the point at which a person should say, I have to intervene?
Yeah, I think there are different types of constellations of symptoms that we see that present for different disorders. But in all of those disorders, it's really the functional capacity that you're looking at. So is the person functioning in a way that they functioned before, or are they not functioning in a way that doesn't make sense? We talked before, I got bicycles behind me. If my kids if they find out that I haven't been bike riding for a month, they know there's something wrong with me, right? And so the family members will know by the way the person is acting that they're either thinking thoughts that are not appropriate, and you find that through conversations, or they're acting in ways that are not typical for them, and are manifestations of mental illness. So, for depression, which is a very common condition, you'll be looking, you look for, is the person sleeping okay? Are they eating okay? Do they enjoy going out for meals like they used to? Do they enjoy spending time doing the activities that they really like to do? If they like to piddle in their garage in the back, or they like to work on carpentry stuff, or they're doing that, and so it's more of a functional capacity that you're looking at. And that's usually when people seek help. And that's the point where they feel like, hey, I'm not functioning at a level in my relationship with my spouse. I'm not functioning well. Sex is not interesting anymore.
Mm-hmm.
I'm not really feeling a drive for that. My relationship at home with my children is not right. I'm not spending time with them or asking them how they're doing during the day. It doesn't seem to be important to me. So loss of interest or loss of pleasure are usually big things that people will respond to or say, hey, I think I need to do something about this.
Yeah, and like you said, that's across the board. It's not just in one area they don't feel like doing something. It's
Right.
the intimate aspects of their life. It's their familial aspects of their life. It's, if they like to cook and they don't want to do that anymore, like you said, ride a bike. So and what social media has done lately, I've noticed, and I know you have as well, is that it's for instance, suicide prevention. It's really big on social media right now. With these long descriptions of what to do if you've seen someone or someone who may be going down that path. So my question to you is, what do you do? I mean, we see it on social media and we share it and copy and paste it and all that. That's great. But in the moment, what can you do?
Well, in the moment, it's always good to be cool, calm, and collected with any kind of situation, especially when you have someone who's either, in a suicidal situation or a situation where they may be wanting to be violent or act out violently. So being calm, but asking, straightforward, appropriate questions. I've noticed lately that you're, the things that you normally like to do, you really don't like to do that anymore. That we get in arguments all the time over little things that don't make a lot of sense. Have you thought about taking your life? Are you having those kinds of symptoms? Because if you don't ask them, it's really difficult to decrease the overall suicide rate in our country. We really have to start feeling comfortable with asking those kinds of questions, and asking them in straightforward ways, not being afraid or going, oh, you're going to get over it, don't worry about it, or you haven't really thought about suicide, have you? That kind of thing. Really, straightforward way of approaching it. So, we talked about what do you do as a person who may be having someone with a crisis in their family, and what kinds of steps do you take? And while a lot of it's posted on social media, I really enjoy publications by the National Alliance for the Mentally Ill, and we've talked about that on our when we were talking before. And there is actually a 25-page pamphlet that walks you through all the things that I can't tell people in these 15 minutes that we're talking. What are the classic kinds of symptoms of mental illness? When should you intervene? What are the kinds of things you should do to intervene? How do you get the person to the right mental health professional? So some of the resources that are out there, and particularly National Alliance for the Mentally Ill resources, are really awesome in that they tell you, number one, this is what you look for. Number two, this is what you do. Number three, this is what you don't do.
Right.
And number four, these are the types of professionals who can help you. And they're actually have 1-800 numbers where counselors will walk you through the process of, what does your insurance cover? How do you go see someone? Who do you see if you have the money to go see him? Who do you see if you don't have the money to go see him? So it's almost like a guide of walking through the process when you're noticing that your family members may be in distress, or noticing that you're feeling in distress yourself and you're looking for help.
Yeah, that organization, I was looking at their website today, and it's www.nami.org, and it's the National Alliance for the Mentally Ill. It is a fantastic support website for family members, for friends of those who are experiencing mental health issues. And it breaks it down specifically for if you have someone who is a teenager, if you have someone who has returned from the military, if you have someone in the family. So it's a huge resource, and I know there are other resources out there that you can go to where you can pick up the phone and call them or visit their website, right, to get some immediate help, even if it's not at a dangerous level.
Correct, and I don't think anybody says, hey, when they answer these crisis hotlines, hey, you're not serious enough for the crisis hotline, right? So you can text 741-741 to the NAMI crisis line, and they'll put you in touch with folks. You can call their 1-800 hotline number, and they'll put you in touch with folks. There's a organization in New Orleans, the National Alliance for the Mentally Ill in New Orleans, where volunteers are manning phones, and we'll talk to folks about how to assess what's going on and what kind of options may be available for their loved ones or their family members that are either in crisis or just suffering from mental health symptoms. 20% of the U.S. population every year has mental health symptoms that raise to a level where they probably would need some kind of intervention or treatment, whether it's I need to talk to someone and just work out what the issues are and what's going on with me, like interpersonal or cognitive type behavioral therapy, or maybe I need medication management, either from my family doctor or from my psychiatrist. So a resource, and I've always wanted to put this resource together. I've been sitting around, most of the time I got a million things to do. And so I said, this would really be a cool thing, because friends and family members call me all the time and they go, what do I do? I've got my teenager is doing this and I have no idea what to do with it. And so I kind of walk them through the process because, I deal with it every day. So it's easy for me to do that. But when you have resources available that will guide you, and there's people backed up that will help guide you, it's really a powerful tool. So I'd even download it if you're not having a crisis right now, and just have it next to your telephone book. And so, if anybody wants to know, you've got the resources to talk them through.
Especially now, as opposed to a few years ago with COVID and people staying at home, and we spoke about this the last time you and I, chatted on Mission Fitness. Which leads us, actually, we received a question from Martin from New Hampshire, and this ties into exactly what we were about to talk about. Is there anything health professionals are doing to prepare for an influx of depression cases due to COVID-19?
I think that we're all on the alert for it, and I do believe that we're having the good thing that we're seeing in mental health now is nurse practitioners are starting to get interested in taking care, and there's specific psychiatric nurse practitioners, and we train mental health professionals every year. So the American Psychiatric Association is training tons of professionals every year. Will we have enough is always the question. How many folks are going to be in crisis to where we'll have enough, or when we start getting vaccines available and getting other things available, the demand may decrease. Right now, I think the demand is probably getting close to its peak, although others have predicted that it may get worse, before the end of the year. But I think the demand is there right now. We see lots of demand. I see it as a chairman of the department, and lots of folks are out there helping. But we're training lots of individuals to deal with these, all the way from social workers through psychiatrists and advanced level psychiatrists for child and adolescents. And so I think we're ready for it. The major drawback, or the major issue, is people just bringing it up and talking about it, and being able to seek help from the professionals that are out there.
Okay, and we just got another question. Are more people reaching out virtually rather than in person? And is virtual helpful, do you find, or does it matter if you're in person or not?
I don't think it matters. A lot of people, we've sort of held to this position as psychiatrists over the years that you have to see the person face to face, or else you're going to miss things. And my position is, if you're seeing them, that's way better than not seeing them. And so, and seeing them, I love Zoom. I love any kind of way that I can see a patient, communicating with them. If it's over the telephone, texting, to any way that you can communicate with a person, mental health treatment's all about communication, and there are times when you have an optimal situation and you can sit in a plush office with, a leather chair and talk for 2 hours to someone and learn their entire life, right? And there are other times when they just may need a 5-minute intervention, or even, a HIPAA compliant text message that says, I'm here for you if you need me, and they get past that crisis. So I'm all for, any kind of way you communicate with a patient is better than not communicating with them. So, and we use video all the time. I mean, the video has been, not to promote Zoom or whatever platform, but these types of platforms have been amazing for psychiatrists. We've been able to help folks that can't see their family members when they're in the ICU with COVID, and talk to them by Zoom.
Yeah.
And we don't infect people when we talk by Zoom, and you don't have to wear a mask. I don't know if you've talked to people with a mask on.
Not on Zoom. I haven't gotten to that point yet.
And so, you media guys don't have to worry. You bypass the mask thing.
That's right. Yeah, I'm in a room by myself right now, so I'm good to go. Okay, so
Right.
we have another question. Does a crisis like COVID increase homelessness due to mental health? And what resources would a person seek if that happened?
Well, the crisis like COVID certainly increases homelessness. I mean, you have when people lose their jobs and when they're unable to pay their bills and do things, then you're going to have an increased level of homelessness. I mean, I think there's no doubt about that. So, but then it gets a little bit more complex. How do they seek help in the midst of that context? So I do believe that the crisis itself, because we have financial burdens on people and we have lots of other burdens placed on the folks, that it increases what we would call stressors. Homelessness is one of the stressors.
Something on the NAMI website that caught my interest was about faith and spirituality. And while they weren't endorsing one or the other, one way or another, they were definitely encouraging, if that is a part of your life that normally would take you to a place of peace, or that you should do it. What are your thoughts on that?
There's tons of studies that support the concept of faith and spirituality as being big, benefits as far as a person's overall mental health. So if you're doing a risk assessment for someone, let's say they're having suicidal thoughts, the fact that they have a strong faith and they believe in God or believe in whatever their faith component is, it helps them to have strength in that process. And you'll talk to people all the time. They'll say, well, if it weren't for my faith, I would have acted on my suicidal thoughts now. So all the way from that to just general well-being. I mean, people do better when they're in interpersonal relationships. Married people are less at risk than people who are not, or people who are separated. And faith is a big component. And we've seen that now with a big movement in what we call, mindfulness type therapies for mental health processes as well. So, your faith can be, I have a faith in God. If you're a Jewish person, or if you're a Christian, you have faith in Jesus Christ. Or if you're a person who may be more into meditation and that kind of thing, your faith may be in the fact that you can meditate and gain peace from that. All of those things are super beneficial for your overall mental health on a day-to-day basis.
Okay, and one last question just to wrap it up here. Again, I put this on you last time. A piece of advice for those who may think a friend or a loved one is getting to the point where they need help. What do you suggest they do?
Well, first is don't be afraid to talk to them about it. The worst thing that can happen if you don't talk to someone about it and then a bad outcome happens is that you're saddled with the guilt of not at least talking to them about it. And when we talk to friends and family members and they go, gee, I didn't know, I didn't have any idea. They feel a tremendous amount of guilt about not asking more questions or not being more open with it. And so it's something that we're all trying to be more open about. even as a psychiatrist, when I've got a batch of kids, and talking to a teenager about it is difficult. When I have to talk to my own teenager about it, I'm like, why would he ever think that? But I have to sit down and talk to them about it and say, look, if you ever have any of these kinds of thoughts, or if they come through your mind, I want you to be able to feel open to just come talk to me about them, and we'll work it out. So destigmatizing the whole idea that because you have an emotional difficulty, we call it a mental illness, but because you're having an emotional difficulty, you can't really talk about it with anybody. Yet, we should all talk about it with our friends and our family. And if it's impacting our ability to function on a day-to-day basis, we should feel comfortable about talking to professionals about it. And, the country as a whole has to kind of get to that point where we don't say, oh, that person's weird,
right,
or that person's crazy,
the stigma is gone, right?
Yep.
Right.
So.
Well, Dr. Thompson, thank you so much for joining us again. Lots of great information. We really appreciate it. Again, we encourage everyone to check out that website, www.nami.org. That is the National Alliance for Mentally Ill. Thank you. Thank you for that. And
NAMI in New Orleans is having a fundraising walk coming up in a little bit.
Mm-hmm.
So if you're interested in helping to support them too, Tulane supports them and I support them, and so we're excited about it. They're doing lots of good things.
Great. And that 1-800 number is 1-800-950-6262. I'm going to start over. That's why I have live TV. 1-800-950-6264. Dr. Thompson, thank you again for joining us, and thank you for joining us on Mission Fitness. Don't forget to subscribe to our YouTube page and follow us on Instagram, and we'll see you next time. Thank you for joining us.
All right. Thanks, Leon.